Hi, what's up, everyone? I'm Szenan-Balance from Szenan-Balance. Welcome to Acupuncture-123. Now, today topic live video. I'm gonna treat myself, right? So yesterday live video, I show you on the acupressure point one, and I show you that I actually have a shoulder pain and shoulder and upper arm pain, and I actually did acupressure point over here, right? And immediately I got relief. And then I went on and treat myself, put needle on my scalp to treat my cervical pain over there, and it went down to not even one. For the pain is between three and 5, and the pain is just gone down to very limited, like about 1 or not even 1, just tightness. And today when I wake up in the morning, it's much better. Until now, you see I can do it freely. There's no pain. It's pretty good today. It's pretty good. And the pain was from here to here, halfway down here from yesterday, and pretty good. Yeah, treatment, acupressure point over here, and needle on the scalp, and it fixes all about it. And now today, that's pretty good now. I don't feel anything. You see, pretty comfortable with that. And the only pain that I felt, I just draw it out, really, and here, and here. So that's when I do this movement. It doesn't happen all the time. I can feel this now. When this, you have to get to the right ankle and right movement to be able to feel the pain, right? So, and this nothing up to here. Yep, start to feel a little bit. Yep, yeah. And the pain level is about 1 or 2. It's not a great deal at all. So, but anyway, today I'm going to treat myself. Well, where do you think I'm going to put it? I'm going to choose balance method acupuncture. No scalp for this today. That's balance method acupuncture first. So, how do we treat shoulder pain? Acupuncture 1, 2, 3. I'm going to show you. But before I show you, I'm going to go to my Facebook, and I hope you do the same. Give it a thumbs up and say hello to me. This is the first thing you can do for me. Thank you. And the second thing that you can do for me is press the share button on your Facebook, please. Share it on your share this live video and get more and more people watch it, please. I'm going to share it right now. I got about 4 people to watch it, but really I only see 2 people in here who's watching. The other 2, I can't see your name at all. I don't know why. Even though I can do it here on my, I'm trying to share it now on my computer. I'm going to share on my other platform that let people know I'm doing this live video to treat myself. Okay, I'm going to share on the group as well. So give you a minute while I share. Can you please share as well, so that we can do the same, please? Thank you. Then after this, after I finish my share, sharing today's live video, then I'm going to start to treat myself. Let's see. Okay. All right. That's it. Come back to YouTube. Okay. If you're on YouTube, please give me a thumbs up as well. All right. Now, how I'm going to treat myself now. It's simple. We come to shoulder pain. I use the opposite side shoulder. You see, now we can see where is the pain. The pain is actually, this is large intestinal meridian, right? Up to here. And actually between large intestine and what? And lung meridian. And so on large intestine, but closer toward to the lung meridian. And that's what we're going to do. So, and it's from here to here, right? And I have a great point over here. It's painful over here. So that is the point I just marked down. Hi, Rachel. How are you? Over here. So that is the pain over here. So I'm going to come to here. Oh, I get 1 point straight away. That point is pretty sensitive, right? So what we're going to do, grab needles. I like to use, this is point 2, I don't know whether you can see it or not, 0.2 times 40 mm. So with that needle here, I may need a few needles. I may need just one needle. Okay. Here's tender. I'm gonna do in here. I don't know whether you can see or not. Oops, turn it around. So there you go. That's one needle. I'm not bothered to. I don't have to worry to put it deep or not at the moment because I'm gonna do more needle for other. Right. Right. Hi, Aaron. How are you? So that is tender underneath as well. Right. So I know, even though I don't have pain down here, but the tenderness spot show in here, which is I had pain yesterday over here, but that's gone now, right? So I can do this. And here, I just put it very, very superficial at the moment because I want to get the acid point still. Okay. Along here, remember all here is the pain from large intestine toward to the lung meridian. So I'm going to press opposite side toward to the lung meridian. Over here, there's another one. There's no pain over here. I think that's good enough. 3 needles over here. It became a triangle. So now I can insert the needle. Insert the needle. Insert the needle. Right? It's actually deep touching the bone right now. All needle touching the bone. Right? Then what happened? That is a very sensitive point over here. You know, when I do this, I feel the pain, but I couldn't actually feel where exactly the pain is. But when I came to palpitate it, I feel there's one point over here is quite sensitive. Then I can go up there, twitching the joint, and find the point. Here is the most sensitive one. Nothing in here, nothing in here. Here. Back here, that one is very, very sensitive. So I'm going to put one needle over there. Here you go. Yeah. And you don't have to do any technique at all. Get to the acid point, insert the needle. That's it. Hi, Mao, how are you? Hi, Betty, how are you? So what happened is you get the acid point, you insert needle. That's it. Don't need to do any technique at all. Okay, now we're gonna do this. Someone on YouTube asked me, do you puncture the same meridian on the other side? What system is that? Okay, this is system 6. Puncture, not puncture. Okay, puncture. I get what you mean now. No problem, Mal. Good friends. We met in Jimmy workshop. Okay. I really want to test it out because I have trouble pain over here and here. There's no pain from today, from this morning. So the only thing that feel pain is in this movement. And only certain, okay, I can feel it right now over here. I'm going to test it out. I'm going to really feel it. It actually, I couldn't tell exactly where the pain is when I feel it. Because it's wild movement. It's along here. I think it's along here. Okay. Very, very, I don't feel pain if I lift it up at all. Only when I lift to certain level, certain degree, and I do this movement, like it's fine in this level, fine, 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 and I don't feel all the time. That is the problem. Fine, it recovered very well, and I can feel a little bit when I pull back in there, just a little bit, not much at all, not much at all, not about one, and nothing now in here, nothing, nothing. Nothing. And a little bit in here, a little bit, when I pull back. Yeah, just about all gone. Just about all gone. Okay. And if you want to do technique, can you do some technique? Yes, you can. If you don't want to do technique, you don't have to. You know, if you put the needle and you want to do some technique, and then that's okay too with this with acupuncture 1, 2, 3 with balance method acupuncture. You know, and I can use just one needle and do technique on it and get it work. And if this, obviously, if you do technique, it's going to be the patient going to feel a bit more sensitive from the needles, right? Feel more pain from the needle. If you don't want to do this, you don't have to do this. If the patient is so sensitive with needles, sometimes you rather choosing putting more needle than stimulate the needle on the point. Because if you're using thin needle, like what I use, 0.20 or 0.16, and you use tube to put it in, insert the needle, break the skin, and get into the needle. The patient won't feel any pain most of the time. If they do feel the pain and are very sensitive, ask them to cough. While they cough, or ask them to sniff. While they sniff, you insert the needle. Or you can, it's very sensitive over here. I can do some technique like this. You know, you don't have to, but if you wanted to, you can do that. So take it out, go to the side, not completely out, just lift it up a bit. Lift it up on the skin. You can do 4 different directions. Hi, Amrita, how are you? Someone say that Butcher said, but you have said before that system 1 is more effective for pain. Please one day tell us about the difference between system and treatment. No, I never said system 1 is more effective for pain. I never said that. Yeah, you probably misunderstood I never said that. Acupuncture 1, 2, 3, 4, 5, 6, all system work for pain. You know, I never said to any of my friends, my students, that which system is work better than the other. I never said that one because that's not in my experience at all. I heard people say that, well, what is which meridian, which system is which one, and I tested out. It's not in my case. I never had those experience. Yeah, I didn't have any conclusion which system worked better than the others. Right? Then we do needle. This is from the technique. If you have more time, you want to use less needle, then you can do some technique in there. whatever you learn from the school, never throw it out. You can combine in your treatment. You can combine in your treatment. You can do a little bit gentle, and I don't feel the pain when I stimulate the needle. You don't have to go and get very uncomfortable sensation. That people say this is the qi and the qi is great and do this. I don't like that feeling, to be honest. And most of my patients didn't like that feeling either. All right. So I know a lot of people want to do this to prove that the qi is good. I really don't do this. And a lot of people didn't like acupuncture because they've been tortured by an acupuncturist. And they come in and say, I'm so afraid of acupuncture. I've tried before, blah, blah, blah. All this thing, but it works, and then they become so scary about the needles, and I needle them. I say, how do you feel? Right? I say, oh, you have good technique. How long have you been practicing? I say, no. I told them that what you told me, all this acupuncturists, they have much more experience. The reason that they needle so pain because they believe in that the more technique and more stimulation, it'll work for you, work better for you. But I don't believe in that, and that's not what acupuncture. They're misunderstanding how acupuncture do and perform. There are many ways to do acupuncture. I say there is a painless way to do it, and you don't have to get any sensation, but you get the results. So I have been proving to all my patients and my practice that patient doesn't need to feel any sensation, what they call 得气, and that kind of 得气 is actually didn't discuss in 黄帝内经. I know most of you think about 得气 is stimulation, and still in the Western world, everyone talk about 得气. Oh, good, I have 得气 sensation. Oh, good, and tell patient, educate the patient. Yes, we need to get 得气 sensation. The patient asks, what is 得气 sensation? Which means you're gonna feel some pain or numbing, or achy, and that is good sensation. I said, no, you misunderstanding, and someone told you the wrong thing. And 黄帝内经 never said anything about 得气 is the strong stimulation sensation. Yeah, never. We can argue about that, but find out where it come from. It's only on your textbook. It never said anything in 黄帝内经. Right? And 黄帝内经 talk about 气质, similar to 得气, but you can understand it's 得气, but you need to find out what 得气 really mean. I meet a lot of people and acupuncturists, and they all talk about when we needle, say, oh, that's good, I got a 得气 sensation. I say, okay, bummer. And even my student, when I teach, I needle, and they feel, oh, great, this is a good point. I feel strong sensation, strong 得气 sensation. I say, oh dear, again. Yeah. Right. So I'm gonna try it, Okay, pretty good. I don't feel it now. Just tightness a little bit in here. Just a little bit tightness. Not even painful. All right. Hi, Kara. How are you? Hi, Rainy. How are you? Hi, Wilson. How are you? All right. We have another question here. Forgive me for a lot of questions. The last one, can we do 2 systems at the same time on the same spot? Yes, of course. Yes. The 6 system, you guys ask me, a lot of people ask me, you put it down, can I do 2 systems together, 3 systems together? Yes, of course. There is no standard. Say that in one treatment, you only allowed to use 1 needle, 2 needles, or 1 system, or 2 system, or 3 system. No. If you're happy with that, if you haven't got the results, you want to chase the pain, you can put as many needles as you want. But again, don't take the needle, don't take the picture and share on your Facebook or social media, because you're gonna scare some people out. People are gonna share it and say, "Wow, this is acupuncture." And some acupuncture is gonna tell you that, "Oh, this is the worst technique I've seen," because they don't understand. Some condition need multiple needles. Yeah, And according to 黄帝内经, it says 气滞. If you haven't got 气滞, okay, 气滞 is similar to 得气, okay, but in 黄帝内经, it called 气滞. If you haven't got 气滞, keep adding needles. Now, first you need to know what is 气滞 means. That means a lot, and different people have different understanding and give it different meaning and 气滞, okay? Right, Aaron, absolutely no need for 得气. The structure around belief is powerful. In WMS, it's called the placebo. Great one, placebo. That's right. Yeah. So a lot of people want, the oldest way to treat pain when I start and old patient. A lot of patients had acupuncture before they come to see me. And they say, "Wow, no pain, no gain." I say, "No, I don't believe in that." Because they say, "Well, you putting needle in there, and I feel pain, and then suddenly my pain's gone. There's no pain, no gain." I say, "Okay, but I don't believe in that." It's different. Mao say, "You are treating pain on your shoulder left and imaging your right shoulder when you are changing the pain. Can you show example?" Yeah, of course. All right. So I'm using acupuncture 1, 2, 3 balance method acupuncture, right? All right. Now today's is because you came out a bit late, Mel, because I actually explained already, but I can do it one more time for you guys. So I have pain from here to here yesterday, right? And that was because I laying down awkwardly and watch a TV program for a long time. And then when I get up, I say, "Oh God, I have a lot of pain in here." I left it. I didn't treat it because I know that at night time I'm going to do live video. I said, this is a great time for treating myself in front of you guys. But I do alternate live video treating myself every night. One in English, one in Chinese. So last night, I actually asked my audience, what do you guys want me to choose? And they choose scalp acupuncture, Dr. Tan scalp acupuncture. So before that, I have another live video. I actually using those points to treat here. Acupuncture 1, 2, 3, using this to treat this. And I use, because they asked me to show Dr. Tan's scalp acupuncture. So I treated myself and it was quite successful. The pain from between 3 to 5, it dropped down to 1 to 2. And after scalp acupuncture, and then it dropped down to none with those. Dropped down to none. And I left the needle while I sleep last night until this morning. And it was good. And the only pain that I felt today, the area is no longer down to here or here. And I put in here, I do this. Not even stiffness. Not even stiffness. No pain at all. The only pain, I couldn't do that yesterday. When I up to here, I felt pain, and it was free of pain. Okay. Then today, the only movement that I felt the pain is when I do this. Here, I can feel stiffness in here, but no pain because the needle over there, it helped. Then in a certain ankle and certain movement, and I felt the pain. And I couldn't tell exactly where the pain is, right? Because it just pain and it didn't last. It just went away straight away. Even though I felt the pain or tightness, and when I stopped in there, it's gone. It didn't actually last over there. Right. So I went and palpitate myself over here. So pain, it was down to here, right, yesterday, and that's no pain. There is no tenderness spot, and the tenderness spot was actually in here, but now it's gone. There's nothing in here. It was in here, and there's another pain. It was here as well, and now it's gone. It's gone. When I palpitated, it's quite sensitive. That's why I draw it in here and here. And because this is, okay, I'm going to show you where the meridian is. So this is large intestinal meridian, right? So which means that is actually not on the large intestinal meridian, right? So it's between large intestinal meridian and lung meridian, it's a between here. So when I went to the opposite side, this is acupuncture 1. Where is the pain? At between large intestine and lung meridian. That's the pain. Acupuncture 2, what 6 system? So system 1, I'm going to choose a between here because system 6, large intestine treat large intestine, lung meridian treat lung meridian. What about system 1? System 1, we're going to choose the leg point because large intestine going to treat it by stomach meridian. And what is this? Lung meridian will treat by spleen meridian because tie in to tie. So between spleen and stomach meridian, I can find the point as well, right? At my groin or at my ankle, right? So this is on the acupuncture 2 system, step 2, you're finding the balance meridian. We're not on the point yet. Then acupuncture 3, because I'm choosing the opposite side, I'm choosing the system 6 to treat it. So when it comes to system 6, I know the treating meridian, then I go ahead to go to system acupuncture 3, then choosing the point. Then look at the image. I feel pain between here. This is halfway and halfway, which is quarter closer to the shoulder, right? So I treat halfway, quarter to here, exactly this quarter to here to get the answer point. That is for this area. And I had a point over there that's quite sensitive. That's why I get to here, this point. So someone asked me, Tariq Ali asked me, you feel more pain during sleep? No, I didn't feel any pain when I sleep. Last night was great. I didn't have any experience in pain while sleeping because last night, it was yesterday, during the day, I gave myself some pain on an awkward position watching TV program. Then I started to feel the pain. At nighttime, I treated. I wear the needle, on the needle, sleep, scalp needle. Then until this morning, I didn't feel any pain. That was much better. And only when I do this movement, I felt pain. Carla say, I tried use balance method system 6, but the pain was. Okay, good point. What's wrong? I don't know what's the problem. But do you get, I have explained for that actually, but exactly what's the problem, I don't know. Do you get the pain? Does your patient get the pain straight away or afterward? When you say get worse, is it because of you needle it and the patient got worse straight away? If yes, then I know probably what the answer is. Can you reply me? Is it straight away the pain got worse? Or it got better and the next day it got worse? Do you get instant relief at all? So the reason I heal quickly, let's discuss why I heal so quickly. Just one treatment, it healed very quick. That's because I didn't hurt myself very badly First thing. Secondly, I treat my organs every day. So my organs are healthier than the others people. So when organs problem are good, when you get an injury, if you have an injury, lay on an awkward position for long time, it cause me pain, then that's gonna heal faster because I have stronger organs function than the others. First, I try liver channel to treat large intestine. Then what happened? Did you get? So the acupuncture one is large intestine, right? Then you try liver channel. That liver channel, that is system 2. And I change to system 6. Why do you change to system 6? Is it because not working on liver channel? I'm just gonna go ahead to treat my organs again with scalp acupuncture. Brandy said, could you tell what scalp point you use? Could you tell what scalp points you use? Okay, yes, I'm happy to share. Last night, when I treat myself, I treat here. This is hand. As you can see over here, this is hand up to here, straight up. And what about here? Here is GB, right? GB straight up, and a conjunction point over here. Over here, you get the acid point, or lower here because my pain. This is shoulder. My pain is going down there. So I go down here to get acid point over here, and a needle over here. Then it works for this. And in the Chinese platform, and they asked me to do juice acupuncture as well. So in the end, I do this much better. Then I show them where the juice scalp acupuncture map is, and I needle one over there. Okay. Hi Navas, thank you for Mohammed. Yeah, thank you for being here and say hello to me. Great. So as always, I'm going to treat my organs. I suggest you treat yourself or give yourself needle every day. Just 1 or 2 needle will do. Make it simple, not complication, not too much complication. I got the wrong needle. I got a long needle. I'm not going to use this one. Short needle will be better. Carla, I need to know why you change your system in step 2. Do you use the both techniques, Ju and Tan? Global balance? No, I didn't do global balance last night. I only do scalp acupuncture in the same season. Nothing to do with the same season, no? Hi, Julia, how are you? Nothing to do with the same season. Or what season is that? I did Tan scalp last night and here. Then because the audience asked me to show them jewel scalp areas, right? And I show them and I needle myself, for example, for them to see, right? And about tongue, point near to stomach, 36. I bit off now, Carla. I want to know why you're using for large intestine meridian. The problem that you said you first start using liver meridian to balance large intestine meridian. I understand that. Then you change to system 6, which means you're using the opposite side of large intestine to treat the large intestine problem, and it got worse. And my question for you is, why did you change from liver channel, treating liver channel, to system 6, system 2 to system 6? If liver channel are working, why do you needle system 6? I want to find out what is, because you asked me what is the problem. I want to find out by asking you the question. Taufik say, thank you, sir, but I don't still understand the scalp you are using. Is it the same with blessing scalp? I don't understand about blessing scalp at all. Yeah, I'm using Zhu scalp acupuncture mat. Okay, I've got you now. You're saying that, Carla, you're saying that large intestine meridian, system 1, acupuncture 1, 6 meridian. Then where exactly the pain is? On the arm, is it? And where about, is it in the shoulder or which part? Because the pain is still the same, so you're adding another one, system 6, and it got worse. Am I right? Is it shoulder pain or elbow pain? Or forearm or upper arm? Got a large intestine, it could be the upper arm, right? Upper extremity. Dennis say, hello master, which point represent organs in scalp acupuncture? 220 here, and Szenan, I don't know Szenan in here is the headline, all right? From here to here, you can go 3 layer, separate in 3 different parts. So the first part you can call near the approximately, okay, near the what 百会 220 is lower jaw, and over here is middle jaw, and over here is upper jaw, and on the upper jaw that's including the neck as well. That's how simple it is. Right? To Nino now, I'm gonna do upper jaw. That's treating the organs. Do you get me? So I only go approximately. All right. If you want to go very, very narrow, exactly this point is what organ to what organ, I can't tell you that. And you can go Google search and get Zhu scalp acupuncture and get an idea, or buy Dr. Zhu's book or attend Dr. Zhu's seminar. All right. And he will show you exactly where the point is. How do you locate those, right? And that is the way that I treat upper jaw, lower jaw, and middle jaw. I needle to my two organs. Yes, not just to my, it's image. And because you can't see it, I saw it. I explain it to everyone every time I do this. So when you see, I only do on to my, right? It's not just on to my. I needle it. I cover the image. The more important in scalp acupuncture is you cover the image rather than treating, because we're not talking about meridian in here on the scalp acupuncture. All scalp acupuncture, if they are based on holographic theory, based on imaging, they are not talking about meridian. So you don't worry about meridian. So when they are talking about image, let me ask you a question. Is it one needle, if the image is that area, all right, let's say 3 finger, this is the area of representing your middle jaw. And the middle jaw have a lot of organs in there. What a middle jaw including spleen, stomach, part of liver, gallbladder, and some part of your intestine as well, right? And pancreas. Are you saying that should I put one needle just in here, in the middle, will cover all these organs? No, because it's an image. So which means in this middle jaw, that will be on the side will be my liver or gallbladder, and the other side will be spleen, right? Pancreas, and over here is going to be stomach, and lower above will be my intestine, right? I said if you want to treat lower jaw, treat all the organs, better way is needle to the skin, go to the side. This is the needle technique you can do. Then I put it in here. Leave the needle in the middle. Do you want to lift the needle like sideways like this? It's up to you, yes. There is no standard say, no, you can't do this, right? Or if I don't want to do all this technique, can I put one needle in here and second needle in here, another needle in here? Yes, you can. Can I needle from this side to this side? Yes, you can. Can I do the side left to the right or right to the left? Yes, you can. As long as you cover the image, it will work. Now, you want to find the access point as well and needle the access point. And don't get me wrong, I'm not saying that when you find the access point, you needle it, it should get dirty sensation. No. Someone emailed me. When I needle it, when you needle the access point, shouldn't you get the painful point because you needle it? You pressing it, you get the access point. It doesn't mean when you needle it, you should feel the pain. You needle it on the access point. The access point shouldn't have any pain. It will work. It will work without pain, without feeling the pain. Okay. Okay. Funny enough, I do have cold in here. There's something that I figured out in my clinic. When I treat on the opposite side, on the distal point, then you might want to find yourself. A lot of people didn't realize that. Now it's the time. You get your hand. It's fine now. So you get your hand and touch the handle of the needle. It's cold on this one. It's cold in here as well. And then whatever you cold, you can use one needle over here and you touch on that needle. You get a new needle out, touch the handle and compare with here and here. You'll find that the needle on your patient's body, on the acupuncture point, the handle is colder than the needle is not on the body. And that side's not as, that one is not. And sometimes while you're treating more and more, while the patient recover, and you take the needle out, you compare it again. Each time you compare, you find that some are getting better and better. When the patient heal, when you take the needle out, it's still warm. It can be warm or no temperature. You can't feel it cold. And my one's cold now. Why is that? Because you are treating here, you needle in here, and the cold energy came out through the needle. You know? I don't know whether you discovered this or not. I discovered many years ago. Every time it has, it's too cold for me, for my hand. And I told my colleague, and they started to realize that, yeah, it is cold. And I let my patient touch the needles. I get one new needle for my patient. I say, now, can you touch this? They touch it. I say, now, touch your own needle on your body, though. They say, it's cold. And they can feel it too, not just me. And they say, why is that? I say, because we need the warm sensation. When the circulation is better, it get warm. And all this bad energy coming out through the needles. If you use plastic handle, you can't feel it. You definitely can't feel it. Julia said, if we using Dr. Chu method, we can use only just 3-line needle on upper jaw. It's area on the tumai, and to both side UV channel area. Yes, that's right. That's Dr. Chu. Have you been to Dr. Chu's workshop? and different direction, and sometime needle on the shoulder. Yeah, you can combine needle on the shoulder, needle on the scalp. You can combine together. Nothing wrong with that. Yes. And Dr. Chu's always put just 3 needle. And again, Dr. Chu put 3 needle in, and he always do dowing, which I don't like to do dowing. Why is that? I'm not saying dowing not good. I've been saying that a lot of time. Dowing take a lot of time. For pain like me, why do I have to do dowing? I proved to you I don't have to do dowing. And I got it immediately. I proved for people last night and Chinese audience. I put needle in and I just get the ulcer point and cover the area, and I move my hand, bang, the pain's gone. I don't have to spend time in there and stimulate the needle and do the dowing. Yes, I have been 2 days seminar. Yes. Yeah. So in the last few, sorry, I just grab my needle in here. In the last few, I think the last few weeks when I needle scalp, I've been explaining to let you guys know that yes, Jew scalp acupuncture go 3 needle and there. Then Julia, you probably know that, and you need to go. If that's a needle, a Dr. Su will go in and out, right? The reduce technique is pull out, put it in the foot, and when in and out technique, it only go for the wide width of the rise. It's very small stimulation. You can't even feel the needle. But the main thing is, while you do this needle, stimulate needle, the patient need, like on my case, I have to do the exercise. If I can't, if I feel pain in this movement, and I have to try while the stimulation of the needle, and I have to lift up my arm, right? This is the case, right? Keep letting it, and that's dowing. Or you patting the arm, or you help the patient up. The second patient help the second, your assistant can help, or you can help it, or you can stimulate needle and help lift it up. You know, this is a good thing. It works. It definitely works. Dr. Chu's been practicing for many years, and he found all the point. And once I asked Dr. Chu, what about if you just put needle in? Would it work? He said no. The main thing is on dowing. But I did practice it too. When in my clinic, I run busy clinic, and you see about 6 patients an hour, you know. Then you don't have time to do all this. You really don't have time to do all this. You want to see more patient, so you want to have a technique that can quickly take off the pain, then move to the next one. You know, so I discover if I just put one needle, a needle here, that's the area, that's the image, needle here, 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 and I keep the needle in one direction, and I ask the patient to do it. Instant relief. I don't have to do dowing. Yes, I do ask the patient to do dowing themselves. I say, well, now in my case, I needle cover the image, and I get the patient to, now you do lifting up here 5 times, in front 5 times, while the needle's there, and have a rest for 5 minutes, and up again 5 times, and the other side 5 times. Every 5 minutes, the patient do it himself. Why do I do 5 minutes? That's experience, because it happened once when I get a patient to do the dowing movement while the needle, and I walked out, and it came back, and the patient keep moving it. Great results. Great result. Never stopped. He or she, can't remember, worked very hard for it. And the next time they come and say, got worse. Very. So why would it be? And I click myself, oh, that's because he or she was moving too much while the needles. He was so happy and keep moving it. He thought everything's fine, and then overuse it. and you can't overuse it. In the 20 minutes, keep moving non-stop, overuse it. So to prevent overuse, the to make the pain worse afterward. They feel great when the needle's in, Then I now needle cover the image and ask them to move. I prove that it's working. Then I ask them to do dialing themselves by just doing 5 or 10 every 5 minutes. That's my strategy. Rainy Tan says, sorry, did not get the cold needle explanation. Do you say the cold temperature say that the pain is healing or not, please? The cold come out of the needles is a good thing. It's not a bad thing, right? So, which means we're not saying that the cold coming out is because it's healing. Well, I'm not saying this, right? The cold coming out which means you can find it. You need to ask your patient, are they feeling better or not? It's better, that's good. Keep treating. And you just tell them that the needle, you can ask your patient to touch it and you touch yourself. And while you treat it, as you treat 1 or 2 or 3 weeks or 1 or 2 months after, and each time you touch the needle, you'll find that the coldness on the handle getting less and less and less. You still retain the needle for 20 minutes or half an hour. But after a couple months, then you feel the needle, it just same temperature as the needle that you the same needle, the same temperature as the one that you didn't insert to the patient. And that means it's healing. Right? It's good. It's just transfer from get the cold sensation out of the body. When the warm sensation when the needle handle is getting warmer or no temperature, not cold, means the circulation is better. Because without circulation, it's cold. The circulation in the body is cold. So pulling out the cold energy is the best thing. There's some question over here. Each scalp level is the image of the triple burner. Not quite get you. Which point represent organs? So you need a 2 mile to balance organs. I explained that already. Each scalp level is the image of the triple burner. Oh, I get you now. From here to here, yes, you can do 3 separate from here to here, and each level is one of the triple burner. Yeah, you can understand that way. Nothing wrong with that. That's just my way to understand it. Okay. Julia said, way I can get theory book I can understand. I really did not understand it all perfectly. It's right. This treatment very good for patient. I don't understand you at all. The first part of your question, I would understand if you can get a book to read it, if we understand it. So you're not understanding me exactly what I'm saying, right? I don't have book in here, but if you have been, following Dr. Ju's, you'll be understand where the point is and how Dr. Ju's technique is. If any of you been to Dr. Ju's scalp acupuncture workshop, then you know how Dr. Ju treat, and you will see the difference when I explain to you. You will see why I do the image. I don't have any book for you. Then you can go online and search Dr. Ju's website and buy Dr. Ju's scalp acupuncture book from Dr. Ju, and I'm sure they can ship it to you. Is it right? This treatment very good for patient. What sort of treatment? I say scalp acupuncture. As I said to many times to all of you that I don't care which scalp acupuncture map. I do care one thing is the technique that I show you, that everyone can do it, and it's gentle. You don't have to spend a lot of time with that. And for pain, most of the pain, you don't need to do Taoing at all. You know, you just needle those, just cover the image. And you can do Zhu scalp, you can do Tan scalp, you can do Jiao Shi scalp, and I learned another one called Tang Shi scalp. And all this work very well. And Taiwan have Wen Shi scalp. They have all different map, scalp map, acupuncture map, and all work. It all works. You can read it and see. The main thing is you get to, or that is Fang Shi. Fang Shi as well in China. It's Fang Shi, very famous Fang Shi. You read the map and you just you understand where the map, how to represent on your head, and you just go ahead and needle them and cover the image. It will work. Do you use only one needle to shoulder or more needles? All right, good question, Carla. It all depends on the patient conditions. I can use just one needle if the area is smaller, if the pain area is smaller. Okay, for that I can use just now. The area is a bit bigger, so I won't be able to use one needle. You want to cover the image. You want to go to the RC point to get the results. If there is 10 RC point over there and the pain is over here, how could you just do one needle to treat all this? Impossible. Impossible. Yes, it's possible. You get a long needle. You needle one point to here through all this area. So long needle from here through all this area. And that's one needle technique. But otherwise, and that's going to be painful because more stimulation, in and out, in and out, in and out, right? So otherwise you keep poking it and see tender needle, tender needle, tender needle, RC point, RC point, RC point, put multiple needle, and that's up to you. It's up to you. There's nothing. No one would say that. For those people who want to say, oh, use less needles better, I say they don't know about acupuncture. You know, some condition you need multiple needles. Some condition you don't need multiple needle. You just need one or two needle. It's all depend on what strategy you apply on. And don't judge people. Don't judge them how many people, how many needles they use, and you judge them, or they're good acupuncturists, they are not a good acupuncturist. No, don't judge by the needles. Don't judge by the needles, okay? Judge by the results, okay? All right, that's it for tonight. I treat my organs along there. Again, I'm not treating on the Do Maria. I actually needle it. I don't talk a lot of image stick because today's live video is mainly for how I treat my shoulder and the upper arm for by using balance method acupuncture 1, 2, 3, and the scalp puncture. It's just I do it every day, so I quickly do it today, so I don't talk too much about scalp, but we talk about the other day if you want to do no scalp acupuncture or any other question. I'm happy that you guys actually give me ask a lot of questions, and I do love that. And Carla, for your or the one that's not working for you, and that is some that must be some reason over there, and you have to find out. Follow acupuncture 1, 2, 3, and you need to find it out yourself. All right, or we can talk another day. That's it. I'm going to sleep. Stay awesome, and I love you all. Bye bye.